Good day, everyone. My name is Ong Junyu, Year 1 medical student. Today, I'm going to talk about the specialty I'm interested in. So, the specialty I'm interested in is plastic surgery at the breast part. So, first of all, I'd like to introduce about what the plastic surgery is. So, plastic surgery is a surgical specialty involving construction or the alternation of the human body, mainly focused on skin, muscles, and soft tissues. And one of the soft tissues included is the adipose tissue, which the etymology of the plastic is plastikos. It originates from the Greek words, and its meaning is to mold and reconstruct the structures of bodies. So there are two main branch of the plastic surgery. One is reconstructive surgery, and another one is cosmetic surgery. About the reconstructive surgery, it focuses on restoring our body part or also improving its function. The reason for constructing the reconstructive surgery is because the patient may suffer from the congenital defects, or the patient might get some trauma on their physical appearance, such as burns, infection, and also cancer. So that's the reason they come for the reconstructive surgery. So example of the reconstructive surgery is cleft lip, soft tissue reconstruction, and also the breast reconstruction. So another part for the plastic surgery is cosmetic surgery. It focuses solely on improving the physical appearance of the body, and it is not necessary and it is elective from the health reason perspective. So for example, it consists of breast augmentation, liposuction, and also rhinoplasty. About the liposuction, it is removing the body fats from a patient so that it will have more slim body figure. And about rhinoplasty is about reconstructing the shape of the nose of a patient. So next, I would like to introduce about the famous plastic surgeons. So the first plastic surgeons that I would like to introduce is Dr. Harold Gillis. It is the father of the modern plastic surgeries. What famous about him is he performed over 11,000 surgery on the injured soldiers during the First World War. So it focused on both functional restoration and also the aesthetic outcomes on the soldiers. Another contribution that he made is the tube pedicle flap. It is a method transferring skin and tissue while maintaining the blood supply. So his legacy has influenced the modern plastic surgeons. And the next plastic surgeon is Dr. Lee Ming Yo. So he's a prominent board certified plastic surgeon based in South Korea. So as we know that South Korea is a country famous in their plastic surgery field. Dr. Lee is also the founder and medical director of the VIP International Plastic Surgery Center in Seoul. Contribution is he develops the innovative techniques such as the harmony rhinoplasty, which rests on the facial natures by having a reconstruction of the nose figure, and it also combines with the various fat grafting methods. So now I would like to introduce about the breast anatomy and also its physiology. Let's start with the axillary lymph nodes. It filters the lymph fluid from the breast and also help our body to fight against infection or the virus. Another part of the breast is the fatty tissue. So our breasts are filled with fatty tissues, and its function is to fill the space around the ducts and the lobules. So actually, what is lobus? So lobus is the mammary glands, and its function is to produce milk during the pregnancy and breastfeeding. So outside the lobus, it consists of the myoepithelial cells, which its function is to contract and pump the blood. So the next part is the areola. Areola is a dark circle of skin that surrounds the nipple, and after the pregnancy of a mother who just gave birth to a newborn baby, its areola will become darker so that the baby can have a clear look on the areola so that baby can congest the milk more easily. Next is about the ducts. The ducts connects the lobus and also the nipples. And its function is to carry milk from the lobus during the breastfeeding. Next is the fibrous tissue, which supports the breast and making them feel firm. So the structure behind the breast is the pectoralis major muscles, and another posterior part is the pectoralis minor muscles. So behind the muscles, there are ribs that lies beneath it. So another physiology about the breast is it contains the colostrum, which baby feeds it, and baby will gain the antibody and the immunity from the mother, and it's called the passive immunity. So another function is the breast have consist of the adipose tissue which secretes the estrogen. So let's talk about the biochemistry about the breast. So first is about the lactose synthesis, and next the breast secretes the seed, and the most important is the breast secretes the estrogen, progesterone, and also the prolactin to produce the milk for the memory purpose. So the estrogen is to form the memory ducts in the breast, and the prolactin is to form the memory gland in the body. And last but not least, the progesterone is to increase the number of lobules and also its size. Next, I would like to talk about the breast cancer stage. So for the stage 1, it consists of the invasive tumor, which is less than 2 cm. And the second stage, the tumor is about 2 to 5 cm. And stage 3, the tumor is more than 5 cm. And the last stage, which is stage 4, the tumor starts to spread to other organs. So there's also other factors that can be determined the breast cancer stage. One is the lymph nodes. So when the cancerous cell start to appear outside the breast, it will come first to the lymph nodes. So when the lymph nodes start to contain the cancerous cell, so it means that the cancerous cell start to spread outside the breast. So the next factor is metastasis. Metastasis is about the spreading of cancerous tissues to other organs outside of the breast. Next, what is the diagnosis of the breast cancer? There's several ways to diagnose it, and one is the mammogram. Mammogram is an X-ray method to examine the breast. Next is the breast MRI, which is the magnetic resonance. And last but not least is the core needle biopsy. It is a method to inject the breast using a hollow tubes and take out the certain tissue from the breast and use it to examine the content inside the breast tissues. So next, what is the symptoms of the breast cancer is first is breast pain. The next one is lumps in breast or armpit. And last but not least, it contains the redness and swellness at the breast cancerous site. Last but not least, I would like to talk about the breast reconstruction surgery, which is the part of role of the plastic surgeon. So first is breast implant, and it is the most simplest way because it causes the less scarring and injuries, and it is less invasive compared to the methods that I will discuss. So basically, it's a silicone gel or saline filled implant, and it is inserted under the skin and muscle of the chest. So before this breast implant, there's a temporary saline implant inserted in the breast implant area. So it is called the tissue expansion, so that it can expand the cavity inside the breast before it is inserted with the permanent implant. So it lasts for several weeks before the real permanent breast implant is conducted. So the second method about the breast reconstruction surgery is the transverse rectus abdominis myocutaneous flap, or is called as TRAM. So basically, it's the rectus abdominis, which is moved to the chest, and it is the consists of the transplant of the skin and fat tissue and also the muscle from the abdomen to the chest. And this procedure is well suited for women with the loose stomach skin. So the next method is latissimus dorsiflex. Latissimus dorsiflex is the muscle located behind of our body, and it involves the transferring of the latissimus dorsi muscle along with the overlying skin and fat from the back to the chest to create a new breast shape. So compared to the LD shape and tram flap, the recovery phase for the tram is longer and LD flap is shorter because the tram involve larger soft tissues transplant compared to the LD flap. So that's all from me.